How do you choose your examples for clinical governance? You would be asked about clinical governance as we have covered why governance is important in the previous video. You would have to give some examples, but how do you choose that example or which example is the right example? Make sure that your examples are strong and they have the adaptability so they can be molded in different situations. You don't want to have one example for every situation because you might mix up under pressure. You might choose the wrong example in the wrong situation. But I would suggest that you choose one example that you can use in multiple situations. Choosing an example involves a patient safety concern was there was an incident report or a near miss that happened that you knew about it. It could be a complaint that led to some changes or improvement, or an audit that demonstrated some problems within the service. Maybe the KPIs were not being met. Maybe people were not happy. Maybe there was a delay or there was a duplication, so it was costing us more. Talk about a pathway design. It could be a communication and documentation problems. Data is not getting into the notes. The communication is not getting to the right people. Talk about prescribing or diagnostic risk. Tests are not being done correctly, orderly, or reported in a timely manner. And include departmental or organizational challenges. When you choose your example, keeping those things in mind, your example is strong. Demonstrate multifaceted personality. Demonstrate multiple prongs within the answer that you can tackle. And that way, your example becomes adaptable. Your example talk about what you did, but you should use I did, but acknowledge the team in the process. When using your examples, identify what was the problem, in what way the risk was there to the patient, what was your immediate reaction, how did you involve the stakeholders, what data you used, what evidence you had, and what change you introduced, what improvement you introduced, what was the result, was it measurable, and how the change was sustained, and what was the reflection, what was the learning for yourself and other people around, and was there any organizational learning. When your example has these building blocks, strong is adaptable. When answering clinical governance questions, avoid these mistakes. Give a textbook definition of governance or use textbook phrases in governance questions or safety or patient initiatives. Do not just list. Don't make your answer appear like a list. This. Use the phrases, use the narrative to weave them into narration to show that you are aware of them. But do not explain each term in length. It's not a knowledge test. It's not a memory test. It's about your understanding. Do not blame others. Do not show that you will find out who did it, what did it. It's not about person. It's about the mistake. It's about identifying the errors or factors that contributed to that mistake and plug those holes so they don't line up. Don't describe an audit without an impact on patient care, without any impact. So back up your data, back up your actions with evidence, and don't forget to acknowledge the team that you worked with, as well as the patient. Their contribution is important because governance is not about policies and meetings. It's about patient care, patient safety, patient perception, duty of candor, staff well-being. So show to the panel that you understand these terms. Use them in your answer. Instead of saying, I'll be ensuring the patient care is good, staff well-being is maintained, duty of candor is followed, then it looks like a list. If you say so, I'll make sure my practice is safe, I listen to the patient, and when things go wrong, I follow duty of candor and explain to them what has happened. Now it's a narrative. You are still saying the same thing, but it's weaved in. And don't forget to demonstrate sustainability. Explain to the panel how you embedded the change so that it became the way of doing things. It becomes culture. People embrace the change that you introduce. So it will happen, come what may. My final tip about governance is do not present clinical governance as just something that happened in governance meetings or a collection of policies, but present it as part of your day-to-day, everyday practice. A strong answer will show that you will recognize the risk, implement and introduce the change, take the team with you together, monitor it to avoid a recurrence, and make the change sustainable. When you demonstrate that to the panel, you move away from theoretical answer to an answer that's credible and demonstrates senior level thinking. And that's what gets you appointed.